Imagine walking into work, trying to clock in, and your badge doesn't work. This was a study for workers in at least 5 of the 12 regional offices of Head Start. The Head Start program is under attack and needs our help. Head Start was created in 1965 by Lyndon Baines Johnson. Since then, Head Start has served 30 million children living in poverty and aided them in kindergarten readiness. With funding in question, families across the nation, including myself, risk losing childcare, forcing them to find somewhere else for their children to go, or risk losing their job. This will cause devastating setbacks for families, as well as stress in the home, and possibly food insecurities. Head Start not only benefits children through developmental screenings, meals, and kindergarten readiness, it also provides resources for families and provides free childcare for parents to work. Being an employee of Head Start for 3 years and having two of my children attend Head Start gives me the credibility to talk about the benefits and need for the program to stay funded. As a previous stay at home mom who was going through a separation, the Head Start in my community opened the doors and helped me find a safe place for my children to attend while I worked. They offered me a better job with more opportunities, helped me through college, and provided essential resources to keep my family afloat. I've seen firsthand the benefits of this program. Head Start needs to continue to stay open and receive funding so hundreds of thousands of children growing up in poverty will get a chance to receive the same care, opportunities, and education as other children. We need to give these children a fighting chance in life and continue to break the cycle. Head Start has benefited 800,000 children and pregnant women in the year 2022 and 2023. The proposed elimination of Head Start is a devastating blow not only to my community, but communities across the United States. Head Start is a key benefit to preparing children for entering kindergarten, both educationally and emotionally. Not only does Head Start provide the educational means to setting children up for success, they also keep our children healthy. Head Start programs are required to help the program participants receive physical examinations by scheduling screening appointments or offering screenings directly on site. And this includes dental, vision, and hearing screenings. Administrative staff does weight checks and height checks on students to make sure they are progressing and meeting their physical milestone. Dental screenings are done twice a year by School Smiles, as well as a vision screening done at the beginning of the school year. To promote nutrition, Head Start programs are mandated to provide high nutrient meals and snacks that meet 1/3 to 1/2 of the daily nutritional needs of participants in part day and full day programs. The CACFP, which stands for Child and Adult Care Food Program, is a federal program that provides reimbursements for nutritious meals and snacks to eligible children and adults who are enrolled for care at participating child care centers. Children receive breakfast, lunch, and snacks each day, including fruits, vegetables, milk, and water. By providing children with meals, we are keeping them from hunger and fighting against food insecurities that devastate our nation. Head Start provides support to pregnant mothers. The Family Engagement Specialist provides information for resources such as WIC and SNAP benefits. The Family Engagement Specialist will provide mother and baby training, including prenatal and postpartum information, education, and services. These programs keep mom and baby safe and offer resources to those who may be facing domestic abuse in the home. The cut to these services would be detrimental to the wellness of these women and the children. These children could face food insecurities if the program were to close. The Trump administration had proposed eliminating the funding to the Head Start program, shutting down centers across the country that will provide vital services to young children and pregnant mothers. The proposed budget for the 2026 fiscal year does not include Head Start, cutting the program and displacing hundreds of thousands of children from center-based care. Parents could lose their job due to not having childcare, and employees would be misplaced as well. The Trump administration goals of returning control of education to the state and increasing parental control is what brought this issue into conversation. Families need to take off work due to the closing of their local programs would go without pay, causing families to fall behind financially. Closing programs have caused a decrease in pay last year. Some preschool classrooms have been closed since January. The federal government has distributed 1.6 billion from January 2025 to now versus the 2.55 billion last year for the same time period. They may be saving money by closing these programs, but at what cost? Families are displaced and lose vital resources for their children. The resources include food, screening, and childcare. This is detrimental, putting families a step back and causing in-home stress, which could lead to substance abuse, or neglect. Many of the children in Head Start are in foster care. By taking the program away, these young children may start to face food insecurity and lack of health needs like screenings and vaccines. Eliminating Head Start would be catastrophic to the early education program. Students will fall behind in kindergarten readiness and basic health needs. Head Start is key benefit to preparing children for entering kindergarten, both educationally and emotionally. Each year, children entering kindergarten need to know more and more than the previous year. A study by the Department of Education in 2015 has found that children that attend early years education were on average almost 8 months ahead in literacy and numeracy compared to those that did not attend. Conducting ongoing screenings and assessments to ensure each child is making progress and collaborating with parents and community agencies when further assessment is needed is another key benefit to our program. Children in programs benefit greatly from social and emotional development. This is our annual report from my center, and it has all of our income, our budgeting, and as well as all of our child outcomes. And these are the different assessments that we do for the different domains. And this is how the children at the beginning of the year were and at the end of the year. So you can see that they are progressing through our program. Children that are attending our program are exposed to other children. Head Start teaches our children how to work through arguments and teaches emotional regulation. By doing this, we can take a moment to breathe and talk through our conflicts. Growing up in a household that you walk on eggshells in is an anxious life to live. Imagine being a young child and watching your parents fight over finances and things that you don't understand. Arguments get louder and louder and continue to escalate. By teaching our children breathing techniques and conflict resolution skills, we can help break the cycle for that child as an adult. When they have children, they will have the skills in place to work through problems instead of lashing out at those around them, creating a healthier group of adults for our future. By working closely with children, we can help learn the process of sharing and taking turns while their brains are still developing. From ages 10 months to 2 years old, a child's brain continues to grow, and new neurons and synapses are formed at an incredible rate. The prefrontal cortex, which is responsible for the decision making, self control, and social behavior, begins to develop. And this is why it's crucial to begin to work with children to build on these skills. Head Start has benefited 800,000 children and pregnant women in the year 2022 and 2023. The proposed elimination of Head Start would be catastrophic to families. Head Start is a key benefit to preparing children for entering kindergarten, both educationally and emotionally. Head Start needs to continue to stay open and receive funding so hundreds of thousands of children growing up in poverty will get a chance to receive the same care, opportunities, and education as other children. We need to give these children a fighting chance in life and continue to break the cycle. I want to close by using a quote by Alfie Kohn. If children feel safe, they can take risks, ask questions, make mistakes, learn to trust, share their feelings, and grow. This is the intention of Head Start.